Hello students, welcome to MCQ video discussion on Medico apps. Today I'll be discussing a MCQ on acute reversible pulpitis treatment. Now you must be wondering that is the reversible pulpitis treatment important? Yes, it is important because when we sit in the examination, we get quite confused between the irreversible pulpitis treatment and reversible pulpitis treatment. So here with the MCQ, I will be able to resolve your doubt on this treatment of reversible pulpitis. So let's start. But before that, I want you to subscribe our YouTube channel by hitting the bell icon so that whenever I discuss such kind of important differences, MCQs, concepts on dental topics, you will be notified for all those. So let's start by resolving the MCQ and let's see what is the MCQ asked here. So here the MCQ which is asked is from the endodontic department or endodontic subject. Now the question asked was in the PGI examination and question framed was that the acute reversible pulpitis is treated by. Now the options here are option A, sedative filling with observation or wait and watch. Option B is pulpectomy. Option C is pulpotomy and option D is pulp capping. Now here the options are really confusing. The question is straightforward to you, but the options are quite confusing. So let's understand what exactly is your option and which one we need to eliminate and get the answer for the treatment of acute reversible pulpitis. So firstly, you should know what exactly is acute reversible pulpitis. So here we will be starting from the first term pulpitis. That means if there is itis means there is inflammation, there is infection. So the infection is present in the pulp region. Yes, there is infection in the pulp region which is reversible. Okay, here the infection is reversible and the infection is acute, that means of short duration. So it is an infection of the pulp which is reversible and is of the short duration, but the patient is having pain due to this acute reversible pulpitis condition. Now what will be the line of treatment? So firstly, as I have told you, it is reversible. So if it is reversible, we can treat this condition definitely. And what are the best treating options for this? So the best treating option for an acute reversible pulpitis condition is by prevention. Now what and how can we prevent the acute reversible pulpitis condition? So we can prevent it by seeing and by preventing the development of the caries. And how we can do? By periodic care. We need to we need to go on for a oral prophylaxis so that we can see that if there is any dental caries, we can go ahead with that. How can we go ahead by that? So by that we can go ahead with the removal of the cause. If the oral hygiene is not maintained, we can ask the patient to maintain the oral hygiene. And if in case you find any initial dental caries like pit or fissure caries, we can ask the patient for early insertion of the restoration. Other than that, in case if we have done an initial restoration in the patient and patient is having pain due to that restoration, we can go ahead with the recontouring by asking the patient chief complaint. Okay. Along with that, what other options can be done? So other options can be done by using of cavity varnish or cement base. Now how is this cavity varnish or cement base helpful? So they are basically these cavity, the caries which has formed in the tooth. We can protect the pulp by putting this cavity varnish or by cement base, and then by putting an restoration or a filling material over that. And we should also take care when we are preparing tooth for our crown preparation. We need to take care of the tooth preparation and polishing so that we don't go and enter into the pulp. So all these are the methods for prevention of acute reversible pulpitis. So do remember these preventions, that periodic care should be taken, removal of the cause, early insertion of the restoration if required, recontouring if required, and putting of the cement or the cavity varnish to protect the base of the pulp, to protect the pulp cavity, so that if there is in case any infection going ahead with the pulp, we can protect it beforehand. And lastly, to take care while tooth preparation. But still, if the patient has still symptoms of pain, what other things we can do in case of acute reversible pulpitis? So in that case, we will firstly remove the restoration which we have done. Okay, firstly we will do that. After that, we can other than the restoration, what we can do, we can place the sedative dressing. Now sedative dressing is the same which I have just mentioned about the cement. Okay, the cement base, we can give a cement dressing of zinc oxide eugenol cement to protect the layer. So this will give a sedative dressing, and it will relieve the patient with the pain. And after that, we don't need to put a restoration or a filling material over that, a permanent filling material over that. What we can do is we can put a temporary filling material, and then we can keep the patient on observation, that is on the wait and watch situation. So I hope you have understood, and now you have got the point that how a acute reversible pulpitis patient can be managed by placing a sedative dressing, removing the restoration which was done previously, and keeping the patient under observation. And what here a point you need to remember is that if still the patient is complaining of the pain after performing all these proper treatment, the steps of proper treatment, then the pulp infection or the pulp inflammation is regarded as irreversible pulpitis. That means the infection has reached into the pulpitis, and then the condition has gone into the irreversible condition, and we have to perform a root canal treatment, that is the pulpectomy. Pulpectomy is the treatment for irreversible pulpitis. So here I hope you have got the answer for you, that what we have to do in case of acute reversible pulpitis. So going back to our question, acute reversible pulpitis can be treated by, firstly, by sedative filling, that is by placing a zinc oxide eugenol base, and then keeping the patient on wait and watch situation. If the condition is fine, the patient is not complaining of pain after some time, then we can go ahead with the final restoration. Okay, other options here are pulpectomy. What do you mean by pulpectomy? The complete removal of the pulp. No, we are not doing that. Pulpotomy. Now, what is pulpotomy? Pulpotomy is when we are removing the pulp from the crown portion. Okay, the root portion or the root base is still intact, and pulpotomy is usually performed in children. And lastly, in case of pulp capping, we are protecting the pulp from the necrosis. So all these three options we are not doing. We are simply putting a sedative filling, and then we are keeping the patient under wait and watch situation. So I hope you have understood the answer for your question, that is the acute reversible pulpitis is simply treated by putting a sedative filling, keeping the patient under observation. So I hope you have understood this question. Keep watching our video on YouTube. For that, don't forget to subscribe our BDS Express YouTube channel. And in case you want such kind of important daily updates, you can join our exclusive WhatsApp group on www.medicoapps.org/group. The link of this group is also given in the description below. Kindly join our channel for all such important updates. Thank you for now. Good day, good luck.